And welcome back on WPSD Local 6 Midday, part one of today's Family Health Experts, featuring Dr. Jared Anderson of Audiology and Hearing Center, Paducah and Murray, discussing hearing loss, hearing aid technology, and all things hearing pretty much in general. And we have a question from Monica, who has an interesting question. She wants to know, how often should you clean your hearing aids?
So in general, you're going to want to wipe that hearing aid off. In the evenings when you take it off, you should have a cleaning brush with that hearing aid. You're also going to want to brush off the microphones each evening or every other evening. If your hearing aid has a filter, it is important that that's being changed about once a month. That keeps any kind of wax, debris from blocking where that sound comes out. If you produce a lot of wax, you actually may need to change it every couple weeks.
Next question comes from Richard, who says, do you have any tips to help me to adjust to wearing hearing aids, and how long will it take to adjust to them, as I just got hearing aids last week?
Oh, okay. Well, congratulations on the new hearing aids. The adjustment period is going to vary. In general, the longer somebody has untreated hearing loss, the longer it takes to adjust to hearing new sounds. So this may take a couple weeks, it may take up to a couple months. Some strategies or tips you can use while you're adjusting is try to wear them as consistently as you can. So put them on first thing in the morning, wear them all day until you go to bed in the evening. If you find yourself in a noisy environment during the day and things are uncomfortable, rather than take that hearing aid out, try turning that volume down to where it is comfortable. That way your brain's still being stimulated and you're still adjusting to that sound.
Our next question comes from Ethan, who says, I happen to work outside, and that includes summer months, and because it's so hot, I usually sweat quite a bit. I want to know, will the sweat damage my hearing aids?
Potentially. It's important to remember that hearing aids are small, sensitive electronic instruments. So any kind of sweat, debris, moisture, dust, that is harder on them. If you are wearing them in those environments, it's fine. But in the evenings, if you have a battery door, make sure that door is all the way open to help dry it out. If you're going to be in those environments often, I would recommend investing in a hearing aid dehumidifier. It's a small electronic box you just keep on your nightstand or in your bedroom. That way at night, when you're not wearing the hearing aids, they can air out, dry those out, and help protect your investment.
Next question comes from Davis, who says, my dad has been wearing hearing aids for a while now, but he says they're not working as well now as they did when he first got them. How often should he have his hearing aid adjusted?
Okay. If he's noticing difficulty hearing, I would certainly recommend he follow up with his hearing care provider for adjustments or to further investigate why he's not hearing as well. I have patients that have progressive hearing loss and they need adjustments throughout the year. I have patients that have stable hearing loss and they may not need adjustments once every few years. But I do like to follow up with my patients every 6 months at Audiology and Hearing Center to make sure that we're continuing to meet those listening goals and make sure that the hearing aid's serviced to allow the best sound coming through. But as people's listening goals change, as they add new environments that they're in, that prescription may need to be updated.
He's Dr. Jared Anderson of Audiology and Hearing Center, our guest on today's part one of Family Health Experts. If you'd like to review this segment, we'll have it online shortly. Look under the Family Health icon at WPSDLocal6.com.